Our team members take pride in our roots. We grew up on farms, we live on farms, and we serve farms every day. At Armor Animal Health, our veterinarians help you detect diseases through our state-of-the-art lab. Our pharmacy then helps deliver the right solutions to keep your herd healthy. With locations across the United States, we have the ability to supply thousands of products to your door. When you kick off your boots at night, know that defending your herd isn't our job, but a way of life.
Hello everyone, and thank you for joining us this week on Have You Heard, Armor Animal Health's video series. My name is Joe Grotsun. I'm a territory manager in Mandan, North Dakota, here in our division of Armor. I've been with the company now for about 4.5 years. And currently I live in Baldwin, North Dakota, about 10 miles north of Bismarck. We want to know where you're joining us from today. Leave a comment in the comment section and let us know where you're watching from. We're also excited to tell you about our winter keyword giveaway. For the month of December and January, listen for the keyword which will be mentioned at some point during the Have You Heard show. Collect all 5 keywords and register by January 26th for a chance to win our winter prize pack and a $250 Armor gift certificate. Simply go onto our website for your chance to win and to enter, and you can also find all of the previous shows there as well in case you missed one, so you can play it back and find that keyword. Today we have Dr. Travis White, Technical Service Veterinarian for SCCL, joining us. Dr. White has been with SCCL since February of this year, and he's been working in the veterinary industry since 2009 and has a lifetime of involvement among the animal agricultural industry. He has a wide range of expertise in large animal veterinary medicine, advanced reproduction, and needle-nail calf care. Dr. White, we are so excited that you are here today. Could you go ahead and tell us a little bit more about yourself?
Absolutely. Thank you, Joe. So yeah, I'm Dr. Travis White. I grew up in the Malad Valley of the southeast Idaho. It's a little town of about 2,500 people, kind of right on the Idaho-Utah border. Went to undergraduate at Utah State University, and after that went to Washington State University for vet school. Upon graduation, I opened a private practice in Wessington Springs, South Dakota. It was about 85% cow-calf, and then did some feedlot consulting and dairy consulting along the I-29 corridor there. And then sold that practice after 8 years, and then transitioned to Transova Genetics, where I led their veterinary training department. And then, like you said, back in February, came on with Saskatoon Colostrum, and since then I've had the opportunity to relocate back to Idaho.
Sounds good. Before I begin today, I also want to let our viewers know, please ask questions as we are presenting today, and leave those questions in the comment section, and we'll make sure we get those answered either during or kind of at the end of the show. And also want to let you know that we do have a prize today, a sample of SCCL Colostrum, the high cal Colostrum actually. So whoever asks the best question today will be winning that prize pack. So make sure you're not shy on asking those questions. Dr. White, although many of our viewers may already be familiar with colostrum supplementation and replacement, can you give us a refresher on the importance of colostrum for newborn calves?
Absolutely. You know, I guess I'll start with a question. You know, what happens to a herd when they're left vulnerable with no antibodies? Well, we're seeing that play out in human medicine right now with COVID-19. So this was a novel virus that was introduced to us. The human population had never seen this virus. We don't have antibodies against it, and so we really have no protection. And so because we don't have protection against that, we're seeing a lot of illness and deaths that have occurred from that. Unlike humans, you know, when a human baby is born, they've received all of the antibodies that they need via the placenta and umbilical cord from their mother. So colostrum isn't really necessary in humans, although it has other beneficial effects in the infant. It isn't necessary for them to get the antibodies. Calves are a little different. Because of the placentation of the bovine, there's no transfer of antibodies in utero. And so when that calf is born, it's completely naive of antibodies and has no protection against any pathogens that it may come in contact with. And so the only way for them to gain those antibodies is to ingest high quality colostrum, ideally within the first couple of hours. And so those calves need to ingest about 200 at least 200 grams of immunoglobulin, and it needs to be done in a timely manner.
Sure. Yeah, a lot to think about there. Definitely with the COVID-19, that's certainly relatable for a lot of our viewers out there. Now that we have a little bit better understanding of the importance of colostrum, why can't we just rely on Mother Nature to do the work for us?
Yeah, so this is the question we get a lot. Why can't we just let the cow do what the cow does and have her raise the calf and make sure that the calf ingests adequate amounts of colostrum? Well, even in well-managed beef herds, when we go out and do testing, we'll see upwards of a 30% failure of passive transfer rate. There was just a recent article in Beef Magazine that they demonstrated a 25% failure of passive transfer rate. So, so a quarter of our calves are failing to achieve passive transfer. Well, what's the big deal? I don't have 25% of my calves that die, and that's true, but not achieving passive transfer has lifelong impacts. So those calves that fail to reach passive transfer are 10 times more likely to become sick. They're 5 times more likely to die prior to weaning. They'll have lower weaning weights, so they'll grow at about 2/3 the rate of their contemporaries. They have a reduced feed efficiency. But like I said, there's some lifelong impacts too. So we'll see increased age at first calving, increased age at first service, reduced milk production, so they may wean lighter calves. In the dairy industry, we know that a calf or a heifer that fails to reach passive transfer, there's about $1,500 in lost opportunity costs. And some of that comes from morbidity and mortality and the lack of gains like we talked, but over half of that $1,500 comes from a decrease in milk production during her first and second lactation. So we can't leave it up to Mother Nature. We have to be willing and able to intervene when necessary.
Absolutely. And so on that note, with passive transfer being so important, what factors increase the risk of failure of passive transfer?
Yeah, so there's a couple of issues, and we've got a couple videos to show here. So this first video, this is what we want. In the perfect world, we want this calf up and nursing within the first couple of hours of life, well bonded with mother, and going to be able to go on and have a second feeding of colostrum in 4 to 6 hours. This calf is going to ingest an adequate amount of colostrum as long as there isn't other extenuating circumstances. But all too often, this other video I'll show you is what we experience. So as you see here, we've got a veterinarian performing the C-section on a cow. And like I said, what we want is like the first video where calf and dam are well bonded, and that calf's going to do great. But what happens when we have things like C-sections or dystocias, things like that? So there are, we'll break these out into dam issues and calf issues, and the factors that may play a role in failure of passive transfer. So when we look at dam issues, that's going to fall into the categories of lack of volume. So this is going to be heifers and aged cows. In my practice in Wessington Springs, we supplemented every first calf heifer with colostrum because we know that those heifers produce a low volume of colostrum. Twins, I have twins in this category, but I'm going to hit on them more later on. But with twins, that cow doesn't produce enough volume to support both of those animals. There may be a variable quality or subpar quality. And so when we have quality issues, those are typically due to nutrition, drought, when we get into vaccine history. We also see a pretty significant summer slump in our colostrum quality. So in fall calving herds, that may be an issue. We also have things like delayed nursing. So this would be things like poor mothers, cows that are exhausted after dystocia. We could also have poor udder conformation where, the teats are too large for the calf to latch onto, or we can have leakage from the udder. So starting, a few hours prior to parturition, some of these cows will start leaking their colostrum, and that may lead to a lack of volume as well. On the calf side of things, Anything that induces stress is going to reduce the ability of that calf to absorb the colostrum that it intakes. And so again, things like dystocia, C-sections, heat and cold stress, things like that are going to be more on the calf side of things that can significantly impact this failure of passive transfer.
Yeah, a lot of things to consider there. I know, especially in the Dakotas, a lot of producers have some issues, especially with heifers, with that colostrum quality. And I think that's definitely something to think about when those calves have some issues down the road. Does that go back to that colostrum quality, or what are we dealing with there? And not a lot of people relate those two things. So that's good to comment on that. I would like to take a moment here to remind our viewers of that we do have that keyword today, and that keyword is going to be colostrum. And so I just want to remind you to keep watching the videos future and keep that keyword in mind for entering that on the website. So back to passive transfer for a second there, Dr. White. So what can we do to mitigate these risks?
Yeah, so like I said, our goal is to have that calf up and nursing within the first 2 hours, and then coming back for a second feeding within 4 to 6 hours after that. If there's any factor that is going to delay or prohibit this from happening, then we need to intervene. So we want to mimic Mother Nature as close as possible. So then we get into the question of, do I supplement or do I replace? So supplementation is when, again, we're going to have a lack of volume potentially. And so we're just going to give that calf a small dose of colostrum to extend the volume that it isn't getting from mom. And then replacement is when we're going to fully replace. We're confident that cow either isn't going to be able to produce colostrum or allow the calf to suckle, or other issues with the calf where the calf may not be able to nurse colostrum. So when we supplement, that's a lower dose of colostrum. It's usually somewhere between 50 and 100 grams of immunoglobulin. And that's going to be like in those first calf heifers, like I talked about, where we need to supplement each calf that comes out of a first calf heifer. Cows that are slow to recover, so we're pretty confident that the calf's going to be able to get up and nurse. The cow's going to be able to get up, but it just may be a little slower process, so that calf may not get the initial colostrum or enough colostrum within the first 2 hours. We're going to supplement those calves as well. Maybe some weak calves or maybe not as vigorous, that they get up and they nurse for a little bit, but then they kind of get tired and they quit nursing again. Those are going to be some calves that we may want to supplement. Again, I have twins in this category, but I'm going to make the argument here in a minute that we should probably put them in the replacement category. And so then we talk about when to replace. So anytime there's a dystocia, so any fetal stress that occurs, we need to fully replace that colostrum. These calves, when we look at stress, it will reduce their ability to absorb colostrum by about 35%. And so because of that large reduction in the ability of them to absorb, we need to provide more immunoglobulin to them in a quicker manner. So we need to fully replace them within the first 2 hours. Again, if we have poor quality colostrum, so this may come from a history of a cow weaning a light calf every year, or a cow that has a history of a calf getting sick, or experiencing scours, something like that. A lot of times we chalk that up to environment or things like that. But again, if we have a 30% failure rate in our cow herd, that may explain why we have a higher incidence of scours or pneumonia. And so we need to replace those cows that have any history of having a calf that is sick or weaned light. Body condition score would be another thing. So cows that are coming in under conditioned, we know that nutrition plays a vital role in colostrum quality. And so if we have a cow that's aged and thin, or come off a poor quality pasture or something like that, and she's not in the greatest body condition, we should fully replace colostrum for her. Bottle calves or any other orphan calves, if we're not positive that they had colostrum, then we need to fully replace their colostrum as well. And then this is the argument for twins. So with twins, we don't know which calf's going to be more vigorous and nurse more colostrum. We want to give them both the best shot at hitting the ground running. So we would really want to replace both of those calves. Again, when we talk about supplements versus replacers, supplements are 50 to 100 grams of IgG, where replacement is at least 200 grams of immunoglobulin. And then in the case for bottle calves, where there isn't going to be an opportunity for a second feeding, then we need to follow that up with another 100 grams of immunoglobulin 4 to 6 hours later.
Sure, absolutely. I did just have a question come in from Renee. She was wondering, when you use the term when it's necessary, and I'm kind of assuming she's speaking to, with colostrum supplementation replacement. So when you say the term when it's necessary, what exactly do you mean by that, Dr. White?
Yeah, so, each of us have to evaluate each situation on our farms. And so, when I say when it's necessary, when you've determined that this calf isn't going to intake an adequate amount of colostrum, or the cow's not going to produce enough, or whatever you deem as there being a risk for failure of passive transfer, then we need to supplement. Again, so like for slow recovery, I think that's when I said it was, if you deem it necessary. But if this cow is going to be slow to recover, and so she isn't going to be standing in the first 2 hours, then we need to supplement. But if, let's say, she gets up within a half hour and the calf is vigorously nursing, then there may not be an issue there. So we really have to evaluate each situation as an individual and then decide when we need to supplement or replace.
Sure, absolutely. I want to take another moment to remind our viewers to keep asking questions and leave those in the comments there, and we'll be sure to get them answered. And the best question today gets to win a free sample of the high-cal colostrum. So keep those questions coming. Dr. White, every year we hear stories about ranchers that find these cold stress calves. When we're calving, especially in the Midwest here, kind of, might not always necessarily be in a calving barn. It might be out in a pasture, kind of out in the elements, and winter can sure drag on here for quite a while. So do you have any recommendation on how to deal with these calves that are dealing with cold stress in relation to colostrum?
Yeah, absolutely. So, when we think about cold calves, we're dealing with hypothermia. And so mild hypothermia can set in as when the body temperature drops below 100 degrees. That's not very much of a drop in body temperature. The average body temperature of a calf is around 102 degrees. So once they get under 100, we can start to experience some of the mild signs of hypothermia. Once they get down below 94 degrees, that's when severe hypothermia sets in. These may be calves that we find flat out, unresponsive, no suckle reflex. We don't know if they got colostrum. We just find them out in the pasture or in the calving pen, and they're cold, mouth's cold to the touch. There's no suckle reflex, and they're really non-responsive. Calves are born with 1 to 2% of their body weight as brown fat. And that brown fat is essential in thermoregulation. And so if we think about the thermoregulatory capacity of a calf, 1 to 2%, or 60% of that comes from shivering. The other 40% come from this brown fat that I mentioned. Well, there's a specialized fat that's in colostrum called colostral fat, and that stimulates the metabolism of this brown fat. And so without colostral fat, these calves can't thermoregulate as well as they should. So if a calf hasn't taken in enough colostrum, they may be lacking that brown fat and unable to regulate their body temperature. So this is the case where we may find these calves that are flat out and unresponsive. In practice, oftentimes I had people find these calves, and then they would tube them with colostrum as soon as they found them. And I'm going to make an argument that we should probably wait just a little bit. So when we find these severely cold, stressed calves, their ability to absorb colostrum is reduced down to about 10%. And so severely reduced ability to absorb colostrum, when we really need to get them warmed up to the point that their suckle reflex returns. We don't need them to nurse the bottle, but we need that suckle reflex to return. That tells us that the body is adequately warmed, and now they can absorb adequate amounts of colostrum. And so, in practice, I had a hot tub. I'd put them in a contractor bag and submerge them in the hot tub and get them warmed up. It's a great way to get them warm. NIPCO heaters, Any way we can get that calf warmed up in a timely manner. And then once that suckle reflex returns, then we can give a replacer dose of colostrum to them. That replacer dose of colostrum is going to do a couple of things. So it's going to provide a pretty large energy bump because of the high colostral fat. And then it's going to provide a nice heat sink as well. So they're going to warm from the inside out. This is the perfect application. You mentioned high cal as a giveaway. So this is the perfect opportunity to use something like high cal where there's a higher fat content. It's really going to stimulate that calf to start metabolizing some of that brown fat, get them warmed up and be able to thermoregulate once they are up and going.
Absolutely. When we think about calving season, another challenge that a lot of our producers face is issue with scouring calves. Is there anything that colostrum can do to kind of help, either reduce scours or maybe in fact even treat scours?
Yeah, so this is a new area in colostrum, and there's not a lot of research out there. We're funding some projects right now. So it's not something that a lot of people are talking about, but, I'll ask the question. So what would your veterinarian have you do if you had a scouring calf, whether it's, that week-old calf that may be experiencing some E. coli scours, or the 2-week-old calf that has crypto, rota, corona, those types of things? Well, they're probably going to prescribe some antibiotics. But with antibiotics, when we're dealing with those older calves, that 8 to 14-day-old calf that has rota, corona, or crypto, those antibiotics are really ineffective against those. Rota and corona are viruses, and we know that viruses don't respond to antibiotics. And then cryptosporidia is a protozoal organism, and it doesn't respond to antibiotics either. With the E. coli situation, it may respond to some antibiotics, but we are starting to see some pan resistance to antibiotics. And so that E. coli may be resistant to the antibiotic that we've chosen. He may prescribe some electrolytes as a supplement for dehydration, things like prebiotics or probiotics. So these are like your biomosses and things like that. And then he may prescribe some anti-inflammatories, like whether it's flunixin, meglumine, or some meloxicam or something like that. So my experiences with scours comes from my time in practice. So we had a highly pathogenic cryptosporidia outbreak, and it was killing calves. And we had a lot of club calves, so high value calves. I had a 24-stall calf ICU unit, and I'd have those calves on fluids and dumping antibiotics into them. And regardless of what I did, I couldn't save them. A lot of these calves were dying. And so late one night, I was doing a Google search, and I started running across these articles about AIDS patients. And one of the major causes of death in AIDS patients is a cryptosporidia infection. And the way that they combat that is they feed them bovine colostrum. And so I thought, well, if it works for an AIDS patient, maybe it'll work for these calves. So I started feeding these calves colostrum, and within a day or two, they were significantly improved, fecal score improved, they were up and bright and alert and wanting to nurse. And so it really revolutionized the way that I treated scours. And so not only for crypto, I adopted that for any calf that came in scouring. I would put them on 5 days of colostrum supplementation. At that time, there was nothing out there as far as a dose, so I was giving them 1/4 of a bag a day, and but it had profound results on what I was doing. So then, now that I'm with Saskatoon Colostrum, I understand more what's in colostrum and maybe providing some benefit. So when we talk about antibiotics, in colostrum's unique in that it has, thousands of bioactive compounds in it. There's about 250 of them that we know what their function is, but there's, thousands more that we don't really understand. Some of the major ones, like we know, are immunoglobulin. So that calf needs immunoglobulin to have any kind of an immune system. But in those older calves that are scouring, they're not going to absorb any of those immunoglobulin, but it does produce a localized effect called lactogenic immunity, where those immunoglobulins will bind up the pathogens that are within the gut lumen, and then they'll be excreted out. It also has this colostral fat we talked about, not only being an energy source, but colostral fat has these sialic acid projections on them. And those sialic acid projections are a natural antimicrobial as well. There's also things like lactoferrin and lysozyme, and those compounds are, some people may have heard of those in the literature recently because they've found a pretty significant impact of lactoferrin on COVID-19. And just like in calves, coronaviruses, calves scour from coronaviruses, and that lactoferrin has impact on those coronaviruses as well. A lot of our competitors know this, and so they actually harvest the immunoglobulin out of colostrum, and they put it aside, and then they use a bunch of other ingredients to recreate colostrum. It's kind of like milk replacer with immunoglobulin in it. And then they market all these other beneficial bioactives on the human side of things. So they'll market the lactoferrin for COVID-19, or colostral fat is huge in cosmetics, and so they'll market those to the cosmetic industry. Bodybuilders are huge buyers of colostrum because of the growth factors that colostrum has. So there's all these bioactive compounds that work in concert, and many of them will provide the same impact that your veterinarian is looking for by prescribing all these other things. We talk about prebiotics and probiotics. Well, I mentioned biomass. Biomass is one of those prebiotics, but colostrum has 40 different oligosaccharides, which biomass is one of those oligosaccharides. And so it has 40 different ones that support all of the beneficial gut bacteria. Again, some of these other compounds in there act as natural anti-inflammatories, so we don't necessarily need the banamine or the meloxicam because we have natural anti-inflammatories that calm the gut down. So there can be a pretty profound impact by using colostrum as a scours treatment. So we're recommending that they feed, if they want to use this, feed 140 grams of colostrum for 5 to 10 days. That's kind of a wide range. I've had great luck with 5 days, but sometimes with crypto, you will get a recrudescence where they'll improve, and then once we take the colostrum out, they'll get sick again, and we may have to extend that treatment. They can do this by, if the calf is caught up and penned up at the barn, they can bottle feed the colostrum. They can drench it through a esophageal feeder, or we do have some producers that are actually mixing it up in a slurry and then giving that to the calf via dose syringe. So those are a couple of ideas that they can use to use colostrum as a scours treatment.
A lot of interesting information there, and definitely something that I'm sure many of our viewers hadn't even thought of. I know I hadn't heard of it before, using colostrum as a scours treatment. So definitely some stuff to think about there. It kind of plays into a question we've got from Ben here. He's wondering, in a scouring calf, is hydration, meaning like electrolytes, more important, or nutrition, more like milk replacer or colostrum? Is there more emphasis on one or the other? And maybe to that point too, kind of what factors should people be considering when they're trying to decide, what type of colostrum to use, or what type of electrolyte to use? When you look on a store shelf or page through a catalog, there's many different types of colostrum and electrolytes. So maybe could you just touch on if there's more of an emphasis on one or the other, and some factors to consider when thinking about using those products?
Yeah. So, this question comes up a lot, that, should I withhold milk and feed more electrolytes, or should I feed less electrolyte and try to keep them nursing? And the best answer is both. Jeff Smith, who's kind of the guru of electrolytes, through his research, he's shown that calves do better when we keep feeding milk. And so whether they're going to go out and nurse the cow, or we're going to keep them in and bottle feed them, we still need to be providing nutrition to those calves. So electrolyte supplementation helps with, it provides some energy depending on the one through some glucose, but it doesn't provide an adequate amount of nutrition to that calf. Also, the villi of the gut needs milk to actually thrive. And so if we withhold milk feedings, it can have some detrimental side effects to the point where these calves, again, will have some lifelong effects. They won't grow as well. We see them lose more weight than their counterparts. And so we want to kind of push both. We don't want to withhold nutrition. We don't want to withhold milk. But if this calf is dehydrated, then we do need to push added fluids. So you asked about, how do I choose a colostrum, and also what qualities should I look for in an electrolyte? Well, when we're choosing colostrum, again, we want to look for whole bovine colostrum. So that has all of those bioactives that we talked about. It doesn't have anything stripped away. Again, our competitors will strip a lot of the bioactives out and market those in the human market. And I look at it a lot like the Impossible Burger, right? So cows have been making meat in a perfect form for millennia, and then now we've decided we can manufacture meat in a lab using 200 different ingredients to bring that together. And it doesn't have the same nutritional component. Colostrum's the same way. Cows have been making colostrum in a perfect form. And this idea that we can take the immunoglobulin out and then recreate it with 60 to 80 different ingredients like edible tallow and whey protein and things like that, I think is a fallacy. And we really need to try to mimic Mother Nature. When we're talking about electrolyte supplementation and how to pick those, there's a plethora of them on the market. I'm not going to beat up one versus the other, but there are some, I guess, gold standards that we need to strive for. So it needs to have an adequate amount of sodium. So it needs to have a sodium concentration of somewhere between 90 and 130 millimoles per liter. It needs to have enough chloride in there, 40 to 80 millimoles. Potassium also needs to be included in there, up to 30 millimoles. The osmolarity, so that's one thing that we need to talk about. So osmolarity, if we think of whole milk is about 300 on the osmol scale. Once we get above 600, then we're looking at salt toxicity, and we can actually cause more damage. And so we need a electrolyte that has some osmotic pull so that it can push those nutrients in, but it can't be so osmotic that it's going to cause harm to the gut. So we want something we don't want it to be quite 300. We want it to be above 300. So somewhere in the 350, up to 500 range for osmols. And then it needs to have an alkalinizing agent. So these really come in three forms. So there's sodium bicarbonate, acetate, and propionate. If the calf, say it's a suckling calf that's going to go back on the beef cow, the problem with sodium bicarbonate is it's a very powerful alkalinizing agent, but it prevents clot formation in the abomasum, and these calves need to form a milk curd in the abomasum to be able to extract the nutrients from the milk that they drink. And so if we're going to drench a calf with electrolytes and it's going to go right back onto mom, then we want to avoid sodium bicarbonate as our alkalinizing agent. We'd want more of an acetate or propionate alkalinizing agent. And then there needs to be some sugar in there. So we need to be providing somewhere around 2 grams of glucose per kilogram of body weight to the calf. And that's just going to provide, some energy source that they can kind of utilize until they're back up on milk. The other thing in kind of the gold standard electrolytes is going to be an amino acid called glycine. So glycine helps with the absorption of electrolytes. And so if you can find a product that has glycine in it as well, I would encourage you guys to look up some of Jeff Smith's work. He really is the guru when it comes to electrolytes. He's helped develop, I think, Techmix's electrolytes, which is a great electrolyte out there. But there's others that meet that same criteria. So again, not wanting to beat up on one or the other, but we need to have an application. We need to pick a electrolyte that's appropriate for the application.
Absolutely, yeah. A lot of things to consider there, and a lot of info. Looks like we do have some other questions coming in from our viewers. John is wondering, can you give too much supplemental colostrum to a newborn calf?
So you can't give too much. You can give too much volume. I'll put it that way. So we should be targeting about 10% of these calves' body weight. So, if you have an average size beef calf that's 75 to 100 or 75 to 95 pounds, feeding them 3.5 to 4 quarts of colostrum isn't an issue. They can take that in pretty easily. If they get down lower than that, they're under 70 pounds, 65 pounds, then they may only be able to handle 3 quarts. So volume is the limiting factor, but we can't give them too much immunoglobulin. But yeah, our recommendation typically on a beef calf, if we're going to fully replace, is we're going to give a gallon of colostrum at birth, and then we're going to follow it up with a half gallon 4 to 6 hours later.
Sure, that makes sense. Ben is wondering, can electrolytes be mixed into milk replacer? I think it might kind of depend on the electrolyte or milk, or it might depend on the electrolyte. But is there anything you kind of want to comment on that?
Absolutely. So a lot of electrolytes are actually labeled that they can be mixed with milk replacer, and these are going to be electrolytes again that have acetate and propionate as their buffering agent. Regardless of what the label says, I would not recommend doing that. It pushes our osmolarity way too high when we do that. And again, we can actually induce scours to be even worse if our osmolarity gets too high, and then also have negative impacts on the growth of these animals. So I do not recommend doing that. Just separate it. The other thing that feeding electrolytes does is it provides more liquid, it provides more hydration. And so by mixing it with the electrolytes, we're not really adding to the volume of fluid that we're giving these calves. So it's better just to separate them a few hours apart and give the electrolytes totally separate.
Okay, yeah, that makes a lot of sense. Another question here from Larry: does scour guard to pregnant cows help improve colostrum? So there we're talking about kind of a scour vaccine that the calf needs to get the colostrum for. But do you want to comment on that?
Absolutely. Yeah, scours vaccines will definitely help, and they help against the major pathogens, the Rota, Corona, E. coli. The major problem with scours vaccines is timing. And so that cow is going to start to put colostrum into her udder at about 5 weeks pre-calving. If we think about vaccines, those vaccines need anywhere from 3 to 5 weeks to for the cow to mount an immune response to them. So if it's the first time a cow or a heifer is seeing these vaccines and you have to give a booster, that can take 42 days or so for that cow to really mount a great immune response. If it's the second vaccine, the second time she's seeing it, again, it takes about 21 days or 3 weeks for her to mount an immune response. So we really need to be positioning our scours vaccines at least 8 weeks pre-calving. So they're getting their final dose 8 weeks pre-calving so that she can mount an immune response, have time to build those antibodies, and then start putting those into her udder at about 5 weeks pre-calving. So timing can be the issue. When we see major problems with scours vaccines, it's usually because they got too late in the season and, they forgot to do it, and now they've got the first calf on the ground and they want to run all the cows through and give them a scours vaccine. And it's just not enough time to build the colostrum into the udder. Where scours vaccines don't help is if we have a new strain of those pathogens. So again, whatever strains are in that bottle, it's going to be protective against those. But if we have strains that aren't in there, aren't cross-protective, then we may not see as big an impact. But scours vaccines will significantly improve your colostrum quality.
Sounds good. We got a question that came in. They were wondering, they joined us a little later, but they were kind of wondering what's the industry standard as far as IgG levels, and And I'm guessing she's kind of talking in regard to what makes a supplement or what is a replacer. You just kind of want to touch on that again on the IgG levels?
Yeah, so, we consider a supplement being somewhere between 50 and 100 grams of IgGs. When I graduated vet school, I was taught that to replace colostrum, a calf needed 100 grams of IgG in the first 24 hours of life. Well, since then, that's been totally debunked. With new NOMS data and things like that, as that's come out, calves really need a minimum of 200 grams of IgG and probably closer to 300 grams of IgG. And that really needs to be in the first 2 to 6 hours of life. Ideally, 200 grams in the first 2 hours, and then followed up 4 to 6 hours later with another 100 grams of IgG. We really need to be pushing that 100 or 300 gram level. And again, we can't wait 24 hours. If you look at the absorption curve for these calves, our highest absorption occurs in the first 2 hours. By 6 hours, we've reduced our absorption capacity by about half. Once we get out to 12 hours and beyond, we're under 10% of absorption. So it really needs to be in the first couple of hours for that first dose.
Sure, absolutely. Well, it looks like that's all the questions we have that have come in right now. If you are watching the recorded version of this and you think of something, please still ask that question and we'll make sure we get it answered for you. I'd like to announce our winner of our free sample of colostrum, Ben, for his questions that he asked on colostrum. So we'll have someone send you a Facebook message to get your info so we can make sure to get you your prize. So we again want to thank Dr. White for taking the time to be a part of today's Facebook Live. We hope you learned a little something on how to help keep your calves healthy for this upcoming calving season. And hopefully that'll include some SCCL colostrum. I do want to put a little bit of a plug in that if you are maybe thinking about trying it for the first time, or maybe you already are an SCCL colostrum user, we do have a special going on right now where with the total gold colostrum product, buy 24, get 6 free. And also on the high cal product with a little more energy to it, buy 12, get 2 free. So feel free to contact us if that's of any interest to you. So just again, want to let you know this video has been recorded. You can certainly go to our Facebook page or YouTube channel to go back and watch it. And finally, I just want to wish all of you out there a Merry Christmas and Happy New Year. We will not be doing any Facebook Lives on December 4th or January 31st with the holiday season, but we will be resuming the series on January 7th. Dr. Larry, along with Micah, they'll be discussing how to take the bite out of the cold weather. That'll be again on January 7th. And also just want to let you know, as we move into 2021 here, our video series is going to start being on every other Thursday starting on the 7th there. So we look forward to that in the new year. So once again, thank you all for joining us today, and we'll see you next time on Have You Heard?